Hi, I'm Dr. Thomas Pane. My paper, Experience with High Volume Buttock Fat Transfer, a report of 137 cases, will be published in the May issue of Aesthetic Surgery Journal. This is a topic I've been interested in for many years now. Practicing in South Florida, we have been doing this perhaps sooner than other areas of the country, and also seeing patients that had high volume transfer requests. Now, there were increased media reports of serious complications and deaths related to this procedure, specifically involving fat embolism. And that got me thinking because I wasn't seeing any of these kind of problems in my experience. Despite what early technique advocates had stated, I never was placing fat into the muscle. I never quite believed in that because that's where the large vessels were, and it stood to reason that that's what would increase your risks of fat embolism. So I pulled my cases together, arbitrarily defined high volume as 1,000 or more cc's per buttock. And in this series, with an average BMI of about 31 and fat removal supernatant about 3,000 cc's, with transfer of about 1,300 cc's per buttock, there were no serious complications. About 86% of the patients were satisfied. The ones that were not satisfied actually wanted to be made larger. Not one person had said that I made them too large. So I think the most important development from the paper is to show that high volume buttock fat transfers can be done safely, keeping the fat in the subcutaneous space, which is what I would recommend to colleagues looking to replicate this procedure. You got to keep that fat out of the muscle. Our societies now have explicitly stated that fat should not be placed into the muscle. And what's next? Well, we want to continue to track our outcomes to make sure that our complication rates are truly low with subcutaneous fat transfer. And I think we also want to develop procedures that we may want to offer to patients who may come back in 10, 20 years with large buttocks that they no longer want, because something that seems great in your 20s might not be so great in your late 40s or 50s. So I think we want to have an answer for them when those patients do eventually arrive. So that's my article, and I hope you enjoy it, and thank you for watching.